All right, good afternoon. My name is Michelle Williams. I report with MassLive, and I'm here with Dr. Keroack of Baystate Health. We're going to be speaking today about COVID and the status on both locally in Springfield as well as further in statewide and as well as the nationwide perspective. So why don't we start things by talking about how things are locally. Yesterday we saw an all-time high in COVID cases. Can you give us the latest on that?
Yes, we set a record as a country again. 144,000 new cases diagnosed across the country. Things have been increasing pretty briskly in Massachusetts as well. We've seen a doubling in the number of patients in hospital over the last month or two, doubling in the number of daily deaths, and we've set some records as a state as well. Here in Western Mass, things have been fairly active in Hampden County, over 11,000 cases, a little less so in Hampshire and Franklin counties and Berkshire counties, but even they are starting to pick up now. Within the hospital itself, we've been as low as 10 inpatients back around Labor Day, and now we've sort of crept back up to, our latest was 56 and across the system. So it's very clear that we're in a second surge.
And on that, where are we seeing most of the cases connected to? Is it small house parties? Is it workplaces?
It's typically personal gatherings. The state keeps track of this and reports on it, the clusters once a week. And 80% of the clusters are personal, either weddings, funerals, house parties, family gatherings of one sort or another. And there still are some outbreaks related to nursing homes. You probably have heard of the outbreaks related to hockey rinks, an occasional restaurant here or there. But most of the retail locations that are following the guidelines are doing pretty well.
And as you said, we are in the midst of a second surge now. How is Baystate both preparing, and what do you see as the next steps as the hospital works to combat this?
Well, we continue to stockpile personal protective equipment to make sure we keep people safe. We are looking at the numbers on a daily basis to make sure that we have enough beds and enough staff to take care of the people. We continue to scrounge for testing supplies. Those are becoming more short supply. We used to be able to do about 1,000 tests a day. Now we're down to about 600 because of competitions from other states. So we continue to watch this through a multidisciplinary group we call Incident Command, and that's Dr. Andrew Artenstein, our chief physician, who's a experienced vaccine and epidemiology expert, is sort of our commander of that group.
And if a person is experiencing COVID symptoms, they get tested and the symptoms become severe, can you walk us through what a patient can expect when they go to Baystate?
Sure. We have 6 drive-through testing centers. It's 795 tests. To call and make an appointment, you would need to get a doctor's order for that. Up until a week or two ago, I could have offered or promised a one-day turnaround, but because of the shortages of reagents and chemicals, it sometimes could be 2 days these days. But you would be given a time to go there with your card. You would get a swab in the nose and sign some papers, and then you would hear back via text within a couple of days.
And there are still thousands of people who need care for ongoing conditions. There are still folks having babies every day. Can you walk us through how Baystate is treating folks with those ongoing healthcare needs amidst the second surge?
Sure. On any given day, we'll have 750 people at Baystate Medical Center, roughly 1,000 inpatients across the system. And what happens is that we will segregate people who are known to have COVID or suspected to have COVID until we know what their test status is. We have now 2 separate units, one an intensive care unit and one a regular medical unit for patients with COVID-related illnesses. And so those are separate from the rest of the hospital. In addition, anyone coming into the hospital for any reason, whether to have a baby or to have an operation, is going to get a COVID test to make sure that they're not incubating as well.
That's wonderful. And so so there are separate wings for COVID and non-COVID patients. Now,
Correct.
Baystate is also introducing a new clinic for patients who are experiencing long-term symptoms connected to COVID. Can you speak to that?
Sure. Part and parcel of COVID illness is an activation of your immune system. The virus is typically in the bloodstream and travels far and wide beyond the lungs. And as a result of the immune response to the virus, people often will have lingering effects. And we don't know an awful lot about this right now in terms of how common it is. People have estimated maybe 10% of those infected. But people talk about COVID brain, that they are tired and can't concentrate or can't think straight, or may have emotional sorts of illnesses, difficulties with breathing. You probably have heard about some of the professional athletes that have had heart problems that have needed to really take it easy so as not to damage their heart. In addition, the liver and the kidneys can be involved. And so there's a whole slew of different organ systems that can be involved with COVID, and even in so-called post-COVID, in other words, they don't come back to proper functioning even when the body's gotten rid of the virus. So we are putting together a multidisciplinary clinic to evaluate people and to give them advice about how to manage these disturbing symptoms.
And for those who may be experiencing some of those symptoms and want more information, where can they find out more?
I think they could talk to their regular physician, or they could call our Division of Infectious Diseases. They're the ones who are running this. And I don't have that number off the top of my head. Maybe you could put it on the
We can
website
share that.
afterward.
Wonderful. And now during the first surge, we did see an increase in people who were experiencing non-COVID symptoms that were serious, stroke patients, people experiencing some heart irregularities who didn't seek treatment immediately. What efforts is Baystate doing to encourage folks to seek treatment for those urgent matters?
Well, visiting with people like you is going to be one of the key things. We've been trying in as many ways as we can in our various websites, social media, and media appearances to assure people that it's safe to come in for routine care. We've set up a number of extra safe protocols. I had to get some blood tests myself the other day, and I signed in through my iPhone. I got a text when it was time for me to come in. I didn't wait in the waiting room. I didn't stop at the front desk. I went right back and got my blood test done. And so we've tried to limit the amount of time that people are going to be sitting and waiting or close to each other. There are a variety of protocols related to wearing masks and disinfection, etc. as well.
And we spoke about how the second surge is in part due to these small parties where we're seeing, not social distancing happening. Thanksgiving is coming up, and people are making plans now for getting together with extended family or friends. Can you share recommendations?
Yeah, that's a worrisome thing. I was following what was happening up in Canada. Canada had their Thanksgiving on October the 12th, and in the few weeks that followed, they had a doubling in the number of cases. And this is a country that hasn't had many arguments about whether or not it's reasonable to wear masks and that sort of thing. And so the thing that worries me is that this is not like a party at a college where we have a bunch of young people getting together and forgetting about masks. We've got older folks as well as young kids and everybody in between getting together as a family, and oftentimes that's exactly when people let their guard down. So I did a little bit of web research on what people are recommending and sort of tried to synthesize this, and there are a couple of things that I would suggest. First, the safest thing to do is to have it virtually. Okay, so let's make sure that everyone understands that if there is a way that you can make it happen through Zoom or web-based technologies, that is the ultimate safest. If that's something you don't want to do or don't feel you can do, you really ought to try to make a plan and think through a variety of steps, almost the way you would plan a menu. The other thing that's important is to think about how you spend the week or two before the holiday. If you are, let's say, at college or going to work, you might want to try to lie low for the 2 weeks before. And maybe if you're in a hot area, a hot spot, consider getting yourself tested a few days before come back for the event. I really think about where you're going to be holding the event. It's certainly a lot safer to do it in a town that's not seeing much COVID as opposed to an area that has a lot. Similarly, people that you're inviting in, if they're coming from a hot spot, that's probably not a great idea. Outside is better than inside, but that's easy to say and not easy to do these days. Hopefully we'll have good weather on Thanksgiving and people will at least be tempted to do some of the stuff outside. And if you can't go outside, having the windows open and good ventilation is very helpful. I think about how many people are attending. Smaller is clearly better. And you need to think about the risk factors. If people have any symptoms of illness, a cold, a flu, a headache, anything, they probably ought to stay away. And I really think twice about people who are elderly or who have chronic conditions like high blood pressure, diabetes, that sort of thing. Shorter events are safer than longer. You probably want to avoid, kissing and hugging in close contact. And as far as food service goes, you are be better off to have a single server plating the meals as opposed to a kind of buffet setup. Those are just a few things that lower your risk, not to zero, but make it a little bit more likely that you're going to get away with it.
Great, thank you for that. And with Thanksgiving coming, we have thousands of college students who are enrolled in schools across the nation coming back. Can you share some tips that both the college students themselves can take, as well as their parents, or if it's a multi-generational household with grandparents living there, can take to mitigate risk?
Sure. I think as a college student, you ought to be avoiding big crowds. So you probably saw what happened with the Notre Dame football game, where everybody rushed the field without masks after they won in overtime. Not a good idea as far as COVID goes. What you probably want to do as a college student would be to sort of stay within your bubble, your circle of contacts that are the folks that you are regularly associated with, and maybe consider getting yourself tested a few days before you decide to come back. It's particularly risky if you're coming from an area like, I don't know, Utah or South Dakota or one of these places that's really having a terrible time right now. Once you do come back, and hopefully with a negative test in hand, you are going to want to be careful around people who are high risk, particularly the grandparents or people with chronic diseases.
And now we're seeing quite a bit of change at a national level with the President-elect Joe Biden planning his administration's efforts to go at COVID. Can you speak to what you've seen of the plan so far and your thoughts on the impacts locally?
Well, President-elect Biden has named a number of nationally respected individuals to his panel. I don't believe they started to meet yet. And I'm certainly hopeful that we're going to have sort of national action even before he takes office. I'd be thrilled if the COVID task force was more active in doing more than it's currently doing right now. The guidance has been kind of on again, off again, and oftentimes kind of conflicting. And there have been a couple of levers that they haven't yet pulled, like the Defense Production Act. We can't test as many people as we'd like to test because we don't have enough reagents. The President has the authority to commandeer a variety of sectors of the economy to turn them toward the fighting of the pandemic, very much like we did in wartime where the Ford Motor Company was producing tanks. If we really had that kind of a national effort, I think we'd do better on a testing and personal protective equipment angle.
Thank you. And my last question is in regards to vaccines. So we are in the midst of an ongoing debate about vaccines, and it seems each time that there is a national poll, we're seeing the rates of people who are concerned about the vaccine rising and fewer saying that they will take it. Can you speak to really address those concerns?
Yeah, I have to say I'm much less worried about that than some other people are. We actually, in Greater Springfield at least, have a very good rate of vaccinating our children when they go to school. I think all but 1 or 2% of the kids will have gotten their vaccines by the time they get to kindergarten. And there are some people who have either medical or religious exemptions. So there are some areas, Nantucket is one, Franklin County is another, in which there's a higher percentage of people who just object to vaccines on general principles. And I think those are difficult, those will be difficult individuals to convince. On the other hand, the people who have simply been surveyed and said, well, I'm not going to get that COVID shot, I think that when the FDA and the scientific advisory panels bless this as safe and effective, and your physician or your provider says that they recommend it, and you see family or friends who've gotten it and seem to be doing fine with it, I think gradually people will accept the whole idea.
And it has become more accepted over the years to get a flu shot vaccine each year. What are you seeing in terms of the immediate impact on Governor Baker ordering school-age children to get the flu vaccine as well as some essential workers?
I have not seen any statistics on that. I have heard, people groaning and complaining about what a pain in the neck is and why do I have to do it, but I'm not sure if that has been translated to actually higher rates of vaccination. So I'm guessing that within controlled populations like school-age children, it's certainly the case. At Baystate, we're now requiring it for everyone without medical or religious exemption. Last year, we were in the mid-90s. I suspect we'll be in the high 90s% this year. But it's a little early to tell what the overall impact will be. The idea is that we certainly don't want to get two viruses at once. Flu and COVID together might be a terrible illness that you just as soon skip. And secondly, a person coming in with a flu-like illness would cause a false alarm as far as testing and personal protective equipment from the flu.
Great. Well, those are all my questions. Is there anything that you'd like to share with our viewers regarding COVID that I didn't ask about?
Well, I think that with the vaccine on the horizon, I suspect that by the late spring, early summer, the great majority of people will be vaccinated and will probably not have to be wearing masks when we talk again, if we talk around that time. So there is kind of a light at the end of the tunnel, but it's a pretty long, dark tunnel. And I think the next 2 or 3 months, with all the case rising that we've seen, are going to be tough, rocky months. And we may be going back to some of the things that we saw earlier in the spring, like field hospitals, which there's one going up now in Worcester, restriction of visitors, cancellation of elective procedures. All those things are now on the table. The hospitals are talking about, are we going to have to do that to get this thing under control yet again? So it is going to be a tough 2 or 3 months ahead of us, but I would emphasize that it's not going to be forever, and we are going to say goodbye to COVID, hopefully forever, come the spring, come late spring.
Wonderful. Well, thank you so much for taking the time to speak with me and answering some reader questions regarding the current status of COVID. I look forward to future conversations with you.
Me too, Michelle. Maybe without a mask.
Wonderful.